Good evening. I'd like to call to order the Cabarrus County Board of Commissioners work session for March the 5th, 2012. As a reminder, if you have cell phones, we would appreciate it if you would make sure they were on silent or vibrate. And also, as a reminder, when we get down to we'll go through all the items, and item number 6 is where we will review the agenda, and we can make any changes on the agenda for the meeting, the regular meeting, at that time, to give you just a reminder. So in front of you, Commissioners, you have the agenda for today. I'd like to accept a motion to approve the agenda. We have added item 5-7 that has to do with the tornado victims from this past weekend, and there's some additional supplemental information. So, may I have a motion to approve the work session agenda?
So moved.
Second.
Have a motion and a second. All those in favor say aye.
Aye.
Any opposed? Okay, great. First items we have are discussion items. We'll take no action on those items. And first up we have is the update on the QZAB projects, Cabarrus County Schools and Kannapolis City Schools. And we have Mr. Lynn Whitkey here from Cabarrus County Schools. And there are a number of other people in the audience from the school board and the superintendent's here if there's anybody else that needs to join you.
We'll take the first item as it is. That is the budget spreadsheet that we have before us. And one of the things I wanted to point out is we're going to be talking a little bit today about a project that I believe certainly the chairman of the committee is certainly well aware of, is Concord High School. At Concord, as you may recall, we have two major projects that are going on right now, and they entail the addition of space, sort of a capturing of space within a courtyard to add more dining room space to the existing dining room for student eating. And then there's also an updating and improvements being made to the auditorium in the school. And early on, when we had bid those projects, there was a substantial savings on the dining room project, and we needed additional funds for the auditorium. So we moved money from the dining room project to the auditorium. As it turns out, as we've worked on, and both of those projects are fairly well along now, and we've encountered some bad soil as we were doing the construction of the structural steel and getting ready to put in the the footings for the steel, and also the new floor slab in that area of the courtyard. It turned out that there was poor soil, soil that wouldn't provide adequate bearing. So we have to replace that soil, and that cost, we were funded to do the construction as such, but we didn't have really a contingency amount of money in the project to address one of these things that sort of pops up in the middle of remodeling work. So we need about $2,000 thereabouts to address the soil issue. And in thinking that we also have a little bit more work to do with the facing of the courtyard walls. And we've encountered some I'm just going to say some bad construction details in the existing masonry work that's going to require some additional tuck pointing and or reinforcement. So we're asking to move that $10,000 from the auditorium project back to the dining room project, so we'll have sufficient funds to deal with these smaller but significant change order items. And that's really the major part of this. Most of the other work that we've been bidding, we just bid the Central Center IT improvements, and that came in well within budget. And we're hoping the case will be true for most of the projects from this point forward. But in this case, this is the one place where we do need to move some funds. Any questions? Okay. If we could go to the milestones then. Here, as I mentioned, we've been doing a lot of bidding over the last few weeks. Actually, this week, later in the week on the 8th, we'll be bidding 3 HVAC chiller and control projects. These are at Central Cabarrus High School, Mount Pleasant Elementary School, and Mount Pleasant Middle School. And we're budgeted for those projects. We're looking forward to getting those bids in, because ideally we'd like to start that work, if possible, during the spring break, and then follow with the finishing work throughout the summer so that it's ready to go in the fall. So we're looking forward to getting those contracts underway. To date, we have 8 of the 9 IT projects, which basically include switches, servers, and wireless systems. 8 of those projects are under contract. We're doing the cabling work, and we're waiting for delivery of some of the hardware. There seems to be delays in that, but for the most part, we're not at the point of being nervous, but just indicating that there are some delays in getting hardware. We do want to push forward, though, with the cabling of those projects. The one project that's left of the IT projects is Weinkauf, and that was one of the projects that was sort of put, as we called it, below the line on a hold status, and we will keep that in a hold status until we near the end of the other projects. As far as the Central Cabarrus High School work, we are probably about 2 weeks away from completing the security improvements to the entrance and administrative offices of that school, and we're going to be starting the window replacement work hopefully as of the spring break. So well on track for those projects, and again, in budget on all of that. I think that's all for these. We are going to be changing the format of this milestone report next month, just to include, we're starting to begin to really close out projects completely, so we're going to start to indicate those projects that are complete and finished so that it's easier to read, because right now it all sort of reads a bit alike, and some of these projects are complete and done with. So any questions?
I was asked about furniture and equipment at Central Cabarrus with the office remodeling.
Yes, ma'am. I've been working with the principal to find out what she really needs in that area. We do have some funds available through the projects that have been bid to date there, that we will be able to help her. She's going to be putting some funds towards that, and we'll help her with some of the funds from the QSCB. I will be honest with you, there was some debate at first about whether or not furniture could be provided under the QSCB funding. DPI and we have gone around and around on that. It's finally come back that they basically are neutral on it. They don't have a position. They said if you wish to do that, that's fine with them. They recommended we talk with, I'll probably missay the term, bonding agent or
Bond counsel, Steve Cordell.
Thank you. And Pam's office, Ms. Dua's office was kind enough to do that for us. We have an opinion that we can, in fact, buy furniture when it's part of the project. What I mean by that is this is not an add-on. In effect, there was no furniture because there was no lobby space or no administrative space in this area before. So there's not something that we could take and move there. It doesn't exist. So in that light, we're taking the position that this is needed as part of the project and going forward with that.
And as you will probably suspect, I was asked about cafeteria furniture at Concord High School. Is that the same situation there?
Yes, ma'am. I think there, unfortunately, cafeteria furniture is a lot more expensive than office furniture, but we're going to be working with the high school to see how we can accomplish that.
Any other questions concerning the projects?
Thank you very much.
Is Will here? Okay, did you hear from Will today? Will Crabtree?
I called and left a message. I did not get a response.
Okay. Well, then we will move on. Next, we have Mr. Schuman is here, and Shannon Johnson with the Council for a Sustainable Local Economy for another part of Mr. Schuman's report.
Thank you for having us. I'm just going to turn it right over to Michael, and if there are any questions at the end that you have for me, I'll be happy to answer.
Okay, well, it's a great pleasure to be here to present the final piece of work that I've done for you. And in your record is the additional material that I've prepared, which is a SWOT analysis, an analysis of strengths, weaknesses, opportunities, and threats, from which one can begin to assemble, I think, some ideas about new directions to move economic development in the county. I also put out a bunch of recommendations that I drew from interviews that we conducted with about 20 small and home-based businesses. I have a more elaborate explanation of all the things that people said in those interviews, and that's why the paper that you have before you says draft on it, because we're going to add that appendix to this as well. It's a long report. There's a lot in there. I won't pretend that I can really do adequate justice in 5 minutes to summarize all of it, but I thought I might just put a couple of things out there that would be useful nuggets to think about. Next slide. The first nugget is that the whole premise of this study is that there is an emerging body of evidence, much of it which is quite recent, that suggests that small businesses are the key source of greater jobs and greater income growth. This article, the headline, the graph, came from the Harvard Business Review 2 summers ago. There's a similar article in the Economic Development Quarterly from Penn State that sort of makes the same point. Next slide. The first part of what I did, I thought I would put 3 slides in here just to sort of recap what I presented a few months ago. The first part of the study is trying to just give a good empirical picture of the county's economy. So 83,000+ people in the workforce here. Of those, 11,500 are self-employed. The unemployment rate's hovering around 8,000. It's been north of 9%. It's getting better. And another data point is that 83% of the existing jobs in the county are currently at locally owned businesses. Next slide. What I calculated was that if we could ramp up local demand 25%, what I call the 25% shift, we could create 9,491 jobs. This is using a very standard input-output model called IMPLAN, that it could generate about $400 million of new wages and $61 million of new potential local and state taxes. Next slide. The jobs are spread across the economy, and I think it's useful to see that there are just many places where these jobs could come from local manufacturing, from professional services, from financial services. Local food is 600 potential jobs. Intermediate businesses, that is trade-oriented businesses, tourism and entertainment. Next slide. From the SWOT analysis, I tried to extract a set of recommendations that I think could be helpful to folks here as you're thinking about next steps to take with economic development. And appreciating that this whole discourse is fraught with lots of politics, I tried to resist any temptation to say which institution should do what. Clearly, you have many qualified institutions in the county. Many of them could take on many of these functions, but I just want to enumerate what the function should be that someone in the county should be doing. Next slide. So the first is, I think it would be useful to democratize decision-making about expenditure of money. The previous speaker sitting at this microphone talked about bidding out a very small amount of money, $10,000 in terms of cafeteria furniture, bidding, we understand, is part and parcel of good government. We want competition. And yet we have not done bidding when it comes to the allocation of grant money or tax reductions for economic development decisions. And I think if we can figure out a way of building in that kind of bidding process for any money, government money, that's given in the name of creating jobs, it will create better results. Next slide. The second recommendation is that many of the small and home-based businesses really are frustrated, that it's difficult for them to acquire information. I know there was a similar recommendation actually in the Market Street study, but this is really a reminder that creating a kind of one-stop information portal for the county that new or maybe even long-standing local businesses could turn to find all of the information they need, not just at the county level, but also at the town level, about what they face in terms of licensing and fees and zoning and health regulations. We heard a lot of concern about lack of uniformity between certain town regulations and certain county regulations. We heard some concerns expressed about customer service and people's getting phone calls returned rapidly and so forth. I think all of this is really just part of customer service, and it's worth looking into. Next slide. We found an enormous amount of enthusiasm among small and home-based businesses for the two councils that you appointed in the last year, the Local Economy Council and the Local Food Council. We also found a lot of interest in forming a local business alliance. That is to say that businesses, small businesses, feel that they do not have a sufficiently clear voice within the existing institutions. And giving them that voice either within those institutions or in a new institution would be very helpful. Next slide. There is growing interest in the county around buying local demand mobilization, interest in creating a directory, perhaps an online directory of local and home-based businesses, perhaps creating a local gift card that could be given as a perk to employees throughout the county, creating a business-to-business marketplace that helped local businesses find local suppliers, and an agency that perhaps served as an intermediary to connect local businesses to government procurement agents. Next slide. There is a lot of interest and, frankly, concern among local and home-based businesses around the difficulties in acquiring capital. There was special interest expressed in creating a revolving loan fund. We tested the idea of using municipal bonds as one potential new source of capital for those funds. Some people were enthusiastic, some people didn't quite understand the concept, but it is worth mentioning that in Portland, Oregon, this concept is being talked about quite seriously right now. Next slide. There is a lot of interest in putting more emphasis on creating an entrepreneurship culture. Many of the small businesses we talked to had had at least one really positive experience with the Rowan Cabarrus Community College. This seems to be an underappreciated, under-known about institution that we should make more front and center in building the kind of entrepreneurial economy we want here. There's a lot of talk about creating incubators around particular kinds of small businesses, perhaps a food business incubator, a mentorship program to connect existing or retired professionals with young entrepreneurs. Next slide. Finally, the study recommends that data be taken from existing practitioners of economic development of all kinds in the county in order to try to get at what is a per job cost of different methods that you might use for trying to expand the number of jobs. Now, this graph here is from a similar endeavor that was done in Lane County, Oregon almost 10 years ago. And what they found was that the per dollar cost of jobs was about $2,000 for local businesses, and in gross job terms, $22,000 for non-local business attraction. And actually, when you took into account that most of those attractions did not stay very long, the net job cost was $67,000. So this actually provided critical information to Lane County about how to prioritize public dollar expenditures. And in the report I outline actually a number of ways that you can strengthen the data to strengthen the public policy decision-making around all of these things. Next slide. The last thing that we're adding today to the report is, again, an exhaustive summary of these various conversations that we had, anything from 30 to 60 minutes with nearly 20 small businesses. And this is hard to read, I apologize for that. But what it shows is that on a number of these proposals, such as creating the internet portal, creating a B2B marketplace, a gift card, creating a local business directory, there's really fairly uniform support for this. And some of the more complicated issues around capital, people asked many more questions about. There was perhaps more skepticism. But generally speaking, among your home and small businesses, there is a lot of interest in these new approaches. And I would just say that within the report, I explain how many of these approaches can be done in a revenue neutral or even a revenue positive way if they're properly designed. So these are not things that should add to local government costs. These are things that if you kind of cleverly support them, they will support themselves. Final slide. I think Shannon and I are going to be working in the next few weeks on just trying to do the final bits of design on all of this and, you know, make sure that this is pretty and able to be distributed to those who are interested. If you have comments, even after today, we welcome them, but I welcome any questions right now.
You mentioned about, which is, I think this has been a concern for a while, about Cabarrus County being considered urban. Is there anything that we can do to point out our differences here? I mean, that's one of the things you have in there about, it's kind of hard to explain Cabarrus County because we do have that nature, but we also are quite rural in some areas of the county.
Right. You know, it's one thing to explain it to decision makers who are open to actually having a conversation, and then it's another thing to deal with rules of grant programs that just say, sorry, under our definition, you are not a rural county. Perhaps the best you could do is link up with one or two other counties, you know, and on average, you would be a rural entity and then be able to go after some of these programs.
And then you mentioned about lack of uniformity and lack of customer service. Were you able to identify in your discussions, was that a problem here at the county level? Is it a I mean, I understand uniformity would be between the county and the municipalities. For a customer service level, was that complaints about what we're doing from this building, or is it, were you able to tell, or was it complaints about municipalities? Because I mean, I hear both. And
yeah, I think the truth is that we hear both. So I would suggest, and I sort of elaborate this in the study, that it probably would be more useful to figure out a mechanism of fielding complaints, concerns, suggestions on an ongoing basis than, I mean, my interviews were, you know, a limited universe, but you want to set in place a mechanism where this feedback is ongoing. I mean, I have to say some of the stories that I heard were fairly poignant. There was a contractor that I talked with who said, gee, you know, and I work throughout this county. In fact, I work throughout several counties. In each of the towns, I have to pay a licensing fee. I wish that there was one fee in the state I could pay. In the absence of that, I wish there was one fee in the county I could pay to handle all of that. Well, that's a very particular thing about one kind of work, but I think it's a useful piece of information to think creatively about.
Commissioners, do you have questions?
Yeah, whenever you were discussing the incentives and the bidding process, could you elaborate on
Yeah.
more on?
So it's really quite simple. It's simple, and frankly, it has not been done around the country. But I would say that if you decide that there is a certain amount of funding, either in the tax space or in other funds, that you're prepared to put out there in the name of job development, rather than feeling like there's suddenly one great deal on the table and it's either, you know, pull the trigger or not, it is wiser, I think, to have a steady stream of applications and kind of benchmark what is the cost for new jobs in the county from a broad range of potential job creators. And that then gives you the ability, I think, to make a sounder judgment about whether a special deal that comes to the table, whether that is a good buy or not. I would also add that some have expressed concern that, well, this would thwart the confidentiality of it. And actually it doesn't, because the committee that oversees this could take a confidential bid and just see how it compared with other local players. The important thing is just to have a process that's open so that every business, big and small, local and non-local, can participate fairly.
Do you have a model or a reference on the local business concept? Because I think that's where some of this came from, is a concern that local businesses, you know, people in the county have not had the opportunity to, or assistance, I don't know what word to use, but, I mean, is there a model out there that you know of that's kind of addressing the local businesses more so?
Well, sure, and not from the standpoint of incentives, except, you know, I think a number of proposals have been kicked around by the Obama administration to do kind of across-the-board tax cuts associated with creating new jobs. That hasn't happened, but that's been discussed. But I would say, you know, if you look in the economic gardening movement, there's probably, you know, several hundred cities that align themselves with this movement and have built their economic development programs around it. And that, you know, a lot of the policies that I'm recommending are sort of drawn from that pool of experimentation.
I'm going to ask the same question, not too much from the presentation, but it's from the draft report. And because I'm looking at, in particularly the M-Plan, the top 40 job-producing sectors, and looking at how they could play. I think it's on page 28 of the report. And what I was curious about, I saw several on here that, to me, without a larger business anchor, that some of those was not going to happen. I mean, we're so close to Charlotte. For instance, legal firms, legal services. We have a lot of law firms in Cabarrus County. Every county around their courthouse has law firms. The big law firms, though, are naturally going to gravitate towards downtown Charlotte. You know, insurance carriers. I know that the Hartfords and Liberty Mutuals and the Travelers of the world tend to congregate places like Atlanta, Chicago, you know, New York. We have some insurance carriers here, but it seems like most of the professional office type occupancies in businesses are going to what may be our biggest competitor in the Charlotte region, and that's Ballantyne in the South Charlotte area around, so that we're left, are we really that competitive to grow those internally? Because most of those, starting an insurance company is a huge proposition for somebody to take on in a local economy. Those are things that we would have to attract from outside, but some of those things, like I say, most families are not going to retain an attorney, full-time basis. Those legal services are going to grow as, what I see as a manufacturing economy that we either have to recruit or build internally. That's where a lot of those things are going to come from.
Right.
And that's where I think one of the biggest recommendations is growing that entrepreneur mentality, because that's what I feel like that we have lacked more than anything else in our local community over the last 25 years. We've always depended upon getting the job at the plant, or getting the job from somebody else, and not thinking of how do I launch my own idea. So.
Right, and I think that it is exceedingly difficult to predict what is the right order in which one tries to create these various jobs. Personally, I have long been very skeptical of any approach that says we're going to pick one sector, nanotech, biotech, textiles, and we're going to really grow this one as our one global niche. I think it's much smarter to create the entrepreneurial culture with confidence that many kinds of businesses are going to grow. And you do have, let me just comment on the first point you made, because I think you do have a very particular challenge here given the proximity of Charlotte. I think there are at least two different visions of what this county is going to be. One is you're going to be a very successful bedroom community for Charlotte. The other is you're going to be a diversified, strong economy. And I think, I really see the county kind of teetering in either direction. And by building out the entrepreneurship resources here, one is at least saying, if we can have a diversified economy, it would be valuable to have that.
Okay. Okay, thanks.
You mentioned in here under get the other page, entrepreneurship training. You've got the Market Street study, entrepreneurship development plan, and then you said, but nobody ran with it. If I Googled that, will it come up? What the entrepreneurship development plan?
Yes, I believe I have a
we have it
copy there. Yeah.
Okay. Because what it says is there's an opportunity to add entrepreneurship training to school courses throughout primary and secondary school. I happen to teach small business entrepreneurship.
Right.
In public school, you have to teach what DPI or the CTE department tells us to teach. That particular curriculum is being rewritten, and it'll be a new curriculum starting in the fall. It's small. It is a smaller class because there aren't as many students that have kind of some foundational knowledge to really be able to write a business plan. But I will tell you that I believe all of our high schools offer at least one section of that. So my group are writing business plans all semester, but it'd be interesting to see, now that I have it, some other information that I could probably use to help with that development. I know the community college level, Rowan Cabarrus Community College has done a whole lot. And I agree with you that the R3 Center, we need to try to help them get their word out more so that more people know how good of a resource that is. And I would say that at least in all the schools in our county, they all offer, all but one actually, offer business and marketing courses and try to help the students to think about, that they might want to open their own business. So it doesn't mean that it can't be added to. You mentioned the Michael Scott Nader Foundation that does micro lending, and it says it's expanding its operations to serve Cabarrus County.
Yes.
Is that? currently available, or do you know what, I'm just
can
curious
answer.
about that, when we talked
Sure.
about that at your committee meeting.
They are located in Charlotte, and they are focusing on green-based businesses or business models that work in that field, weatherization and other types of innovative businesses. But they are interested in looking for candidates in Cabarrus County. So I've met with a couple of the people there, and it's been very preliminary. This would not be Cabarrus County taking on any programming. It would just be, it's just a service that's there, so it'd be a connecting of businesses that are interested to that service.
So maybe what we would do is help promote that to the community so that people would know it was available, that it
Yes.
was another resource available that they could take part in.
Yes, we're just about at the point where I think we with this study completed and being able to reach out to the public with some of this information, we certainly can have that available as well.
Sounds like a Channel 22 project.
Yeah, right. I know.
Since they're listening on the other side of the microphones.
One question I've got, and I was wondering, curious about it, and it's just me talking, and everybody knows by now that I sometimes just throw ideas out there. And have you seen any other communities? We're talking about all the different microfinancing. You're talking about the democratizing the grant process or the incentive process. Have you seen any communities where, if say a business has got two suppliers in front of them, one's a local, one's a non-local, where the community provides incentives, say once a year they audit and they have a certain percentage of their purchases are made from local businesses, that it's an incentive is provided back, some kind of rebates provided to that business by keeping those dollars by them. That way, if you have a price disadvantage from an out-of-town supplier versus a local supplier, that sometimes can make up that difference.
Is that done by local government?
Have you seen it anywhere?
I have not, except that there's a state legislator in Colorado who's proposed that the state revamp its procurement standards to move in that direction. And that is the only one that I'm aware of. I mean, there has been some movement in procurement law generally, changes in USDA standards about how to, bring in more local food in school lunch programs. But it's not been very advanced. I mean, really, the best examples that I've seen are not so much where the government is leading, but really where in communities there's kind of a cachet with businesses declaring that they have shifted 10% of 20% of their procurement to other local businesses.
Okay.
And that information then gets posted. And that may be, the easiest kind of low-cost way of encouraging that behavior in the county.
I've got a question for Shannon. Will the Sustainability Council be using this report to make recommendations to the commissioners, or will they not really be making recommendations? Will it just be more of a guide or a
Well,
process to help?
So this is, we've discussed this several times since the very beginning of their establishment. And basically, these are recommendations. So what they'll do is what they came up with from their retreat that were priorities and what they've found in the community as other events have happened, they will use these recommendations along with that to really determine their focus. Being a council that meets once a month and volunteers, they have limited access to how much they can accomplish in a year's time. So these things are really important to help them prioritize their activities. And so the other part that will happen is if there are activities that are very important to them and they fall back to my purview, then I will, be working internally to see how we want to go forward with some of those. But this is a long list, and this is a long-term, some of these are very long-term, and some of them are a little more, they're set for a little further down the road when we've accomplished a little bit more, so.
Did you get any complaints from the UDO?
The-
Wait a minute.
It's the Unified Development
Yeah,
Ordinance. It's
yeah,
a regulatory
Unified
zoning
Development
ordinance, planning and zoning ordinance.
Cabarrus County and City of Concord has.
There were a few complaints about that. Most of the small businesses that we talked with were not affected by the zoning ordinance in any major way, but there were a couple, and yeah, they expressed some concerns.
Well, there's a lot of anti-small business in that ordinance, and, you know, to grow small business, we need to get less government involved in business.
Yeah, I think it's really, it would be really useful to, again, if there's a way of getting people to get, I know there, you know, when it comes to taxes and zoning and regulations, there, among many small businesses, there's a lot of frustration. And if we can channel that frustration into very specific recommendations about, if you do this, you will make my life easier, that kind of feedback would be really helpful, I think, in revising some of your codes.
I know we just finished with some of those meetings. When is it going to be a report to be given to us? Shannon?
Yes, so the transcripts from those meetings are going to be worked through by the committee, the regulatory committee of our council, and then they have to be separated out into what are municipal versus county.
Okay.
And then, so internally, the Planning and Development Department will help us do that. And so it'll boil down to the common denominator, and is there something that we can bring to recommend? And so they'll be doing that. Their plan is to be able to make the recommendations to you in June, at your June meeting.
As I believe I remember telling our former county manager that very thing, that we're going to form the council, and what if the number one recommendation comes from that, it's just, you just need to get the heck out of our way, and we can do it, you know?
I think it'll be more
Just get out of our
specific than that.
business. Yeah.
I'm pretty sure.
Hey, well, what are the next steps to finish up the report? And what can we, other than recommendations in June, what else can we look for in the next couple months?
So for this report itself, the recommendations in June will come from the council and the work they're doing. So for this report itself, if there are any further comments or suggestions, we'll take them. But we're just gonna work on a final publication of the report with all the appendices, and then that's it. So you should be able to have that in another month, I think.
Okay.
Thank
All
you.
right. Any other questions? Everybody good? It's good to get a lot of information. You know, the good thing is, you know, I used to have a small business. You have a business. You have a business. Jay has a business.
I don't.
You don't.
Well, my son
but
does.
It is nice. You know, there are a lot of things that I think that just by living here and what we do on a daily basis, a lot of this does confirm, you know, some of the ideas that we may have. And then, of course, it's nice to have examples of things that are going on around the world, or around the country that you're familiar with that we wouldn't necessarily know about here, and see, you know, through your council what they recommend that, you know, we move to. I know your group's working really hard, and it's a very good group.
They
and
are. They're very excited and energetic. They're working hard.
They have a lot of questions. They're still trying to kind of figure out which way they want to go with everything, and so it's kind of exciting to see that, you know, something that we started, what seems like a long time ago now. For you, it's probably not that long ago. You know, it's starting to give us some specifics and some things that we can kind of chip away at. And I think everybody in this room, not just the elected people, but everybody in this room will agree, we've got to do something to get more jobs here. And we need to do a concerted effort towards that, and we need to look in every direction possible in order to make that happen. And wisely use our dollars, which are really the taxpayer dollars, to make that happen. And so thank you very much for your report and for keeping to get us in the right direction, I guess is what I want to say.
Thank you.
Thank you.
Okay, Commissioners, as you are aware, and the folks in the audience are aware, we are trying to look at the different departments that get funding one way or another with county dollars and, in some cases like today, state and federal dollars, more federal than state is what I read. And so we are going to talk about social services, programs, and financing today. And Ben Rose is here, and I know you have some board members here. Do you want to introduce them? Do you want
Yes,
me
I
to?
can.
We would like to, you guys work very hard on the board, and we'd like to make sure you get recognized. And
Definitely.
if any of them are going to help you with your report, they're welcome to come join you at the
They're
table.
more than welcome to help. First, I'd like to just take a moment to introduce, I have my management team here. Pam Graham with our finance department is here. Angela Talley with our child support division is here. Connie Polk with child welfare division is here. Trish Baker with economic services is here. And representing adult and family services, Kathy Maurer is here. And James Polk is here, who is retiring next month, so feel free to badger him with a lot of questions today. And we do, actually, we have all representatives of our current board right now. John Kennedy, who is our chair, is here, with Kay Scott, who is our vice chair, and then A.L. Fleming. And of course, Mr. Meesmer is a representative on our board as well, too. So we're glad to have all those folks here, and they're here to help me with the question and answer session, definitely, especially if you ask me something that's a little above my head, I can hopefully call on those people to help. But thank you again for this opportunity to come give you a brief overview of social services and what we do down on South Canyon Boulevard on a daily basis. We work to basically administer and deliver federal and state social service programs for the county. We try to be both efficient and effective with our programs and meet the regulations and guidelines that accompany each program. We provide probably close to 100 different types of services within the department amongst those 4 major divisions that I just noted. We are a county department, but we are supervised by the state from a programmatic standpoint. So we do work with the state. We have state consultants that come in on a regular basis and train us and advise us and oversee our programs. They monitor our programs on a regular basis, which we'll talk a little bit more about as well, too. But we are a county department. Sometimes people confuse us. They think we're a state agency, but we actually are a county department. And of course, we do have a Board of Social Services that it serves as our advisory board to the department, as we've introduced as well, too. Most of our services are mandated by either the federal government or general statute on behalf of the federal law. We do have a few optional programs that we operate, but for the most part, our programs are mandated in some form or fashion. And then there is a chart in your packet of information that kind of covers some of that and cites the laws that back those programs. We have 4 primary service areas that how we divide ourselves within social services, economic services, child welfare, child support, and adult and family services are currently how we're structured. I'm going to hit these briefly, give you a couple of facts about them, tell you about a couple of trends we're seeing, and then I'll hit very briefly on financing. The Economic Services Division, which Trish Baker oversees that division, that is the financial support programs that are mostly based in federal law. They're typically known as the income maintenance or public assistance programs from the historical data. They primarily cover the food and nutrition program or food stamps, the Medicaid program, Work First cash assistance, and special assistance eligibility. Workers in this area primarily deal with taking applications and determining eligibility for these programs, and they go through a very complex process to do that. It's more than just writing down a little bit of information and looking up a couple of things. They're verifying a lot of information. They're having to run numbers, and the calculations they have to run need to be very exact because we need to make sure if we're going to issue benefits, we're doing it correctly. And in addition to that, they have to recertify all the cases that exist. And that's a huge process. We've been averaging right now probably about 1,800 to 2,000 recerts a month based on the caseload sizes, and it's become quite a challenge. As you can imagine, one of the major trends we're obviously seeing in economic services is the increase in caseload size. I did a couple of researches here on some data from the state website, and it was interesting. I came here in July of 2009. At that time, we had 8,031 cases that month in food and nutrition or food stamps. And the latest count the state had on their website was December of 2011. We had 11,990 cases. So we have seen a 34% increase in food stamps since I've been here. Hopefully I'm not contributing to that, but it's just been, again, a sign of the economy and the issues that we're dealing with. And now actually Tricia's informed me that we're actually approaching the 13,000 case level now at this point in time. So we've really seen that's been the biggest growth program that we have due to a couple of issues. Eligibility expansion has been included within some of that from the feds as well. But again, the poor economy, it's more of a general program that people can qualify more than our other programs. But Medicaid has not been without its growth as well too. In September of 2008, there were 18,324 cases of Medicaid in the county. And then in September of 2011, 3 years later, there were 22,663 cases, which is representing about a 20% increase. So even in the Medicaid area, we have seen a huge expansion within that program. Again, the workers, they receive the applications, they process, they determine eligibility. The Medicaid eligibility is especially a very complex program when you deal with long-term care, nursing home placements and so forth, calculating deductibles, and it takes a lot of skill and a lot of training to get very efficient within that area. And right now, at this point in time, our caseworkers are averaging about 700 cases now per worker, which is quite a big increase. I think when I first came, we were probably at about 500 cases per worker, maybe even a little less than that. So we've seen a great deal of expansion. We did not request any new positions with our budget request this year because we understand the budget situation, but there's definitely a need within the economic services area. And part of the issue there is that when you start to get these bigger caseloads per worker, they're more prone to make mistakes. And when you make mistakes, we can be prone to sanctions and penalties. We have to, if a person comes into our office, we have to see them that day or make an appointment with them and get that application process started. We have 30 days to process food stamps. We have about 45 days to process Medicaid unless it's a disability case, which we have a little longer on that. But they have to work that case very, very quickly usually and make sure they're getting things done accurately. The state has made it very clear that they are increasing their monitoring of us, and that is in part, they don't make any bones about it, that's in part to try to find errors and collect money from us, the county, to generate their own revenue stream because their Medicaid claims have gone up so much, and they don't make any bones about it. So we are subject to quite a bit of monitoring. They come in and pull cases and check them, and if we have issued, on our end, if we've issued wrong, we may have to pay back. Like for Medicaid claims, we may have to pay back Medicaid claims. So if we've given Medicaid to a client that has a very big claim and we were at fault, we may be dinged for that claim, which can be expensive. So it's a challenge. It's a huge challenge within the economic services area right now. We don't see any trend down where we always are hopeful that the economy will pick up and we can see some reduction in caseload sizes. But at this point, it's nothing but it's been a trend upwards. Child welfare is another area that is completely different from economic services. We are under the Title 4B and 4E Acts of the Social Security Act. We are to conduct investigations of child abuse and neglect by caretakers. When we have investigations for abuse and neglect, when we go in and do an investigation, we do a thorough assessment of the situation, try to determine what exactly is happening, interview family members, interview the children, interview collaterals, and then we come to a decision based on if we feel like there is abuse or neglect as defined by the general statute within the home. And if there is, then we may refer that case to receive services within our in-home services department. If we find that there is severe abuse or very, very severe neglect and the child is in danger, if we leave the child there, we may end up having to file a petition to take custody of the child and place the child in foster care to try to work the situation out. The goal there is to try to keep the child safe if we have to do that, and we only do that as a last resort. Our primary charge but from the federal government is to keep families together, and that's what we try to do. And we've actually been able to maintain a lower foster care case due to a lot of upfront and preventive services, and we're very proud of that. This is probably one of the most difficult jobs that our department does. It's one of the most stressful jobs, if you can imagine, just knocking on the door of a parent and telling them we're here to investigate a complaint of abuse or neglect. It usually doesn't start off on a positive note, and it takes a person of great skill and training to go in there and really work with that family, because we are there to try to help them, but they don't always see it that way when we come in at the door. Some trends that we have been seeing in child welfare, probably the most prevalent trend is an increase in what we call forensic cases, or sexual abuse, or bad physical abuse. We have seen I think, again, you can tie some of this probably to the economy, but we're seeing just a great increase in that area. And those are the most difficult cases that we have to deal with. Our foster care caseload, well, again, we have tried to keep that caseload stable and try to get services into the home. It has been growing a little bit over the past year. We've had several cases that have involved numerous children coming into custody that we have to then provide services for, and of course then the court becomes involved and the court has jurisdiction over the case. So we have been seeing some growth in that area. We've definitely seen a very big growth in our in-home services, which is the cases where we find that there may be abuse and neglect, but we don't feel the need to remove the child, so we refer it to in-home services, and they develop a treatment plan and try to help the family with those needs and keep the family intact. But those caseloads have been maxed out. The workers are at maximum standards that they can have there as well. Child welfare, of course, we do work very closely with our legal department, with the courts, with the guardian ad litem. We involve the schools. We try to address all issues with our partners on a regular basis and work effectively with our partners to make sure we can protect children and try to keep families intact when we can. And our goal there is not only to keep them safe, but to get them to permanence if we have to take them out of custody. We have 1 year if we take a child into custody to try to get that child to permanence, and we work very hard to do that. And that has, again, helped us in keeping our foster care caseloads down. I don't know the exact time frame, and Connie would probably speak to it a little bit more, but at one point in this department's history, there were about 350 children in foster care, and we now have about 58 to 60, I believe. So we have done a really good job getting those numbers down and trying to keep them down as best we can. The next area is adult and family services, which is our coming retiree, James Polk, oversees adult and family services. And this division deals with a couple of types of services. They deal, of course, obviously with adult protective services, which is one of their key areas. When we have disabled adults, whether they're senior citizens or they're under the age of 60, if they're disabled, they are vulnerable to abuse and neglect as well, or exploitation. And they receive complaints from the public on that and do investigations and try to get services in place. That's one of the primary roles that they perform. In addition to adult protective services, though, they do work with families to help secure child care services. We administer the federal child care subsidy program, where we receive over $5 million a year to help support working families to have child care, to help keep them employed. We work with the energy program and emergency assistance programs to help families with energy crisis and emergency situations that they may have. We get federal and state dollars for those services as well. Guardianship is another area that is starting to see some growth due to the fact that PVH has kind of gotten out of the guardianship business. We have about 40 or so wards, I believe, that we provide services for. As a public agency, we are, in general statutes, one of the really getting to be about the only agency now that if there's no private person or family member available, we can be the guardian for a disabled or a person that's deemed incompetent. So that's an area that we're seeing more work in as well, too. And then there's a lot of other little services we do. We monitor adult care homes, we monitor daycare facilities and help with adult daycare homes. We do case management and emergency intake and assessment. So we provide a lot of different services within this area. Again, trends that we're seeing here, guardianship services will probably be on the increase in the future with the PVH removing themselves from that. APS reports have definitely grown. And again, you tie a lot of this to the economy. Exploitation has become more of a common factor. Children stealing from their elderly parents, and we are seeing more and more of that happen. We've had a couple of very difficult cases in that area. So we are seeing more in that as well, too. The demand for childcare has actually not been increasing, and again, that is tied to the economy with not as many people working, because childcare is typically tied to employment. We've actually seen a lessening in demand for that service. And our Work First program, which again, that's the old traditional welfare program, where now with welfare reform in 1996, it's a time-limited program, and we promote work and provide work employment services to our clients. We've actually seen a great increase in success within that program. We have what's called a participation rate that we have to meet. It's a federal requirement that is given to us, and we have to have at least 50% of our folks involved in work activities that are receiving welfare. And we actually placed, last month, I think we were 17th in the state in terms of our participation rate. We were well over 70%. So we've really worked hard and collaborated with a lot of agencies to get that number up, and very proud of that. The last division that we have, and of course sometimes this is a division that kind of flies under the radar, but it really does a lot of great things for families, is child support. We have the role and responsibility under the Title 4D Act of Social Security to basically initiate, establish, and collect child support for people that have an absent parent from the home, and they basically come to our office and apply for this service. We have probably about 5,000 or so cases within the child support area. Some child support is still handled by privately through attorneys and so forth, but we do serve a decent population there. It's a caseload that really has not grown much over the years, but we do a very excellent job within this area. Very pleased with this. We will collect well over $900,000 in child support this fiscal year. And if we are measured in this area by what's called incentive goals, the federal government establishes 5 incentive goals that we have to meet, and that helps us bring revenue down to the county. And last year, we met 4 out of 5 of these goals and did really well. In fact, we were featured on Channel 36 News. They did a story on our child support program. You might have seen that last year. So we're very pleased with the work that goes on there. And again, this is a program that collaborates with the legal department and the courts. We're in court every Monday. So Angela was there today in court dealing with cases people are brought into court if they get behind in child support, and we're establishing child support. We do DNA testing right in the office now. We swab the mouth with a Q-tip and do DNA testing. So our agents do an excellent job, and we're very proud and pleased with the work that they do day in and day out. So those are the 4 major areas that we have. Again, within those areas, that's a quick summary. There's a lot more that happens, but that gives you a little snapshot of what we do. And I included in your packet a lot of statistical information about the programs, and kind of gives you some highlights. So they're pretty self-explanatory. I didn't mean to bombard you with too many papers there. I tried not to, but they're pretty self-explanatory in terms of what the data brings you. To talk just briefly about the financing. The financing of social services is very complicated. It's something that even after 20 years, I still don't always completely understand how our financing works. But basically, we do receive federal and state dollars to help support our mission, and as well as county dollars. We have, and in your packet, I actually included, I tried to do some fiscal 101, that those are some good, tried to break down our financing in very, very general terms. So hopefully that'll be some information that will help you. But federal funds, as Liz noted, is the primary source of our funding. The state does not come to the table too much for us. In fact, the state is down under 5% of our funding at this point. And probably 4 years ago, they probably funded maybe 10%. So they've never really had a lot of money into our budget. But our primary sources are federal and county dollars to run our programs. We have 2 types of funding. Basically, we have a capped allocation and open-ended funding. Open-ended funding pretty much means what it means. We have, as long as we have expenses, we can get reimbursement on that funding. Open-ended funding typically is seen in the economic services area and in the child support area. So if you wanted to give me 100 workers today, which would be great, we could basically get reimbursement on those 100 workers. There's no cap to it. And we claim that on a monthly basis, as we are mostly a reimbursement system. We mostly get our money back after we spend it. Now, there are some drafts that we have for certain services, but for the most part, we're getting it on a reimbursement basis. So open-ended funding is pretty easy, and in economic services, we get back at least 50% of the cost that we have to administer that program. And again, that's federal dollars. There's absolutely no state dollars in that program. That is completely federal and county funded dollars there. Child support, we get a little higher reimbursement rate at 66%. But again, after that, it's county dollars that we get. But it's open-ended funding. We can pull that down as long as we're spending the money. And then in child support, in addition to the revenue we get on the expenses, we do draw down the incentive dollars that I talked about earlier. And we usually get about $100,000 or so roughly a year in incentive funds. Those are funds that have really shrunk. Probably 15 or 20 years ago, I would imagine this county was probably running child support at break even, or maybe even, I know this is a bad word in government, but at a profit. They were probably pulling in more because the incentive dollars were huge, and they restructured those incentive dollars a few years ago, so they have been greatly reduced. But we still do pull them in based on our performance there. The CAP funding, that's a little more tricky. That's a little more difficult because, again, these are pots of money that are basically that we draw down for specific types of services that we do. Say, for example, foster care, we have a pot of money that we can draw down for some certain foster care services. We have block grants. We have several block grants that we get that cover a variety of services, but they're usually, our workers are basically coding to that block grant. And then once we spend that money, it's gone. And then we either have to shift it to another pot or we basically turn it into county dollars. Child care is another good example where we get the subsidy we get for the actual payments. That's a block grant. Once we spend that, it's gone. And then we get some administrative money, but it's a set amount. So once we pull that down, once we claim that, it's basically we run the program at the county expense. So those are the two types of funding systems that we really pull from. And again, the state putting in less than 5% now. The county is probably putting in probably 35 to 40% of the funding for our programs, and the feds are kicking in the rest. We have, our system is a cost allocated system as well too, so all our overhead costs, all our costs of operations and our cost of rent and all those things, that's shared amongst all the programs. It's allocated throughout all the programs. So when we claim those costs, those block grants absorb some of that cost as well too. So that definitely helps the grants get spent down a lot quicker. The only other difficult funding source that we have is what's called a Work First Block Grant. This is, again, with welfare reform, they block granted that service and basically shifted it to the states, and then they have provided us a block grant. But for us to pull down those federal dollars, we have what's called a maintenance of effort that we have to meet, and that basically is the county's portion of what we used to spend in the old days on welfare. Once we meet that county portion, then we pull down all federal dollars to provide Work First services. And those dollars, in addition, help to cover some child welfare services and some child care services. We have an issue with those dollars next year as the feds have reduced those dollars significantly, so we are going to see some revenue impacts next year from that, especially in the child welfare side. For the future, we definitely have some interesting trends forthcoming. Healthcare reform that was passed in Congress will hit us in 2014, and it's going to hit us hard because it expands the Medicaid eligibility. So we think we have a lot of Medicaid cases now. If healthcare reform stands, we're going to see a lot more. So we're preparing for that impact. We are in the process right now of implementing what's called North Carolina Fast, which we jokingly call it North Carolina Slow because it's been coming for 25 years. But we're finally getting there. We will have that program in October, which will help us. It's a case management system that will automate our process. We start with food stamps, and then we'll roll slowly into other programs with Medicaid and hopefully across the agency as well. So that is something that at least is coming in and will help us. Child welfare, again, we continue to see difficult trends there. I think, this is an area that we always want to have trained and experienced and seasoned staff, and in this area, we especially want to keep our seasoned and veteran staff here. Rich can tell you a little bit about that, having served as our attorney for the past year. It really is it's a stressful job, and we've been reading some innovative things that other counties are doing to help with retention in that area, because we definitely deal with a lot of difficult cases there and want to. And that is the one area as well, too, that we don't have any staffing requirements within the other divisions, but that is one area that the general statutes prescribe, that we have a worker to case ratio and a supervisor to worker ratio. The other areas, we don't have that. But it's a difficult job, and the nature of the job will, we definitely need to keep our staff, keep the turnover low there. The state provides us with less than 5% funding. I'm thinking next year they might be down to 3%. It's just, they are cutting at every turn. And in addition to cuts that we might see in terms of our revenue streams, I think you're going to see more cuts in services such as Medicaid. They're going to probably start to there's a lot of services that they provide within Medicaid that are not required, they're optional. And I think the state will probably start to cut some of those Medicaid services as well, so there won't be as many benefits available to clients. So I think those are some trends that we're going to see. But that's kind of a snapshot of what we do. We definitely, our staff, is wonderful, and all of them work very hard day in and day out. We have an excellent team over there in the department. I think a team that you can be very proud of. We take pride in what we do, and they are working, and like right now in Tricia's area, they're overwhelmed with, they have some turnover. They've had some turnover, so they're down some positions, and those 1,800 recertifications, they're just overwhelmed with them right now, and they're working hard to still try to get those out. And they've gotten a lot of phone calls a day, and you might get phone calls in the end, but we're working to try to get it out, and they really do a good job, and all our staff are dedicated to providing the best quality services we can, and the most efficient and effective way that we can as well, too. So very, very proud of what we do. But with that, that's a very brief overview. We're happy to answer any questions that we can. And feel free to put James on the hot seat. We got to give him a hard time before he retires.
I wanted to ask you, you've got a number of budget pages here, and you have a number of different colors. Are there, whether it's blue, yellow, or?
Well, I have them in black
there,
and white, naturally. Is it possible to bring them up on there so I can see what you're looking at?
Pick 96, and a number of them around there. I'm just curious if there was any of those with the different colors. Is there?
Oh, that's the matrix. Okay.
Is the matrix. Does that tell us certain things are mandated, or?
Yes, I think the matrix does. And
match
Erica's
hours?
coming up to
There
help.
you
She
go.
helped develop that. But yes, definitely deals with some mandated stuff.
The matrix is on. Okay. The matrix is the same as I shared with you in the retreat. Basically, it lets you know what programs are mandated, and then based on the color coding, whether the level of funding is mandatory. So if it's green, you have the least flexibility. That's generally mandatory. If it's blue, it's mandatory that we provide the service, but we do have flexibility in how much we fund the service. And if it's yellow, there's full flexibility there. We're not mandated to have the program, nor are we mandated at the funding level as well. So it's the same as the materials that are provided at the retreat.
And I presume that, I presume this is also on our website, so that anybody else that wants to look at it, so sometimes we ask a question so that anybody at home can also, understand what that color coding is, so. You mentioned workforce. You said for the future, there are going to be some revenue impacts. And what goes on, Work First?
Work First?
I'm sorry, with Work First, you mentioned
Right.
revenue impacts. Can you explain that a little bit more? And primarily, does that mean that you're going to lose funding positions? Are you going to lose employee positions, or is it services that would be available? I wanted to make sure what you meant by that.
I understand. The TANF block grant, which is TANF stands for Temporary Assistance to Needy Families, is a federal block grant that comes to the state, and basically it establishes the Work First program, which is the old welfare program. That's what I was talking about with our participation rate. We provide those services, and within that, there's a lot of services that are provided. TANF In addition to that, TANF helps to fund child welfare services. We can pull down federal dollars to do investigations. We usually pull them down, it usually helps us with the intake process when we get that initial report, and we take the report and we screen it we have to screen it on a bi-level area to determine if we have jurisdiction to get involved. And then when we investigate and make a decision, TANF dollars help to support that. That is where the cut is going to hit us. So basically, what's going to happen is there is where you have a mandated service and a mandated level of service. We're going to lose a revenue stream. So basically, what we lose there will be a shift to the county in that one.
Okay, well, that's one of our legislative goals. We're not really fans of the shift to the county.
Yes.
Thing, yeah.
And I'm saying that in the nicest of ways possible. We're not real fans of that getting shifted down to us. Can you bring up page 77? I'm just kind of curious on this one. Mostly the bar, that's fine right there. You've got work first clients, the number required to participate, the number that was participating, and then a very small number in perspective of those actually entering employment.
The total work-first clients that you see there are some work-first cases, they're typically called what we call in the business child-only cases that are not subject to the work requirement. That could be a grandmother who's taking care of a child. So we have a lot of child-only cases that basically we'll never touch those to that second graph. Then when we get to the second graph, those are the ones that are eligible and required to participate in that program. Our goal there is once we get those in, get that total number figured, then that's the goal that we have to try to at least 50% be working with them and involving them in work activities. That's our participation rate, basically. And what's happened now is the caseload has gotten so small because with the time limits, these are time-limited benefits now, we just don't have a huge population now to pull from. So that's why we don't have quite as many in employment as we'd like.
Okay, but so I'm just trying to make sure I understand. The third one, the second one is the ones that are required to participate.
Right.
Of that number, 50% has to.
We'd like to have 100%, but
Right.
our goal is 50%.
We have to have at least 50%,
Right.
and we're obviously doing much more than
Yes.
50% in the
Yes.
third.
That's correct.
And then the fourth one, after they've been, what kind of work experience is that?
Work experience basically is, what we've done is we've collaborated with some nonprofits and even some private agency or private companies to basically allow clients to come on site and do work, basically, and it gives them that experience. We try to, of course, fit the client with what they'd like to do, but we can't always do that, but they're basically going there and involving themselves in work activities. They're an employee, basically, free of charge to get that experience so they can learn how to report to work on time, and do work activities. In addition, they can be involved in certain activities like job search, job readiness classes. We do a lot of classes on site. We do financial counseling classes. We do life preparatory classes, teaching them how to prepare budgets, cook meals, organize their family, help with regular day-to-day family items. So they're involved in about 30 to 35 hours a week of activity in that. So that's kind of what the work experience process is.
And then transitioning into employment, is part of the problem there the recession and the lack of employment opportunities available?
Yes.
Or is it the flip side of not wanting to have employment?
It's twofold. It's definitely part of the recession, but then again, at the end of that time period, if we've done all we can do for them and they've elected not to move into employment, that's part of it as well, too.
And at that point in time, if they've elected not to go into employment, you've done everything you can, they are no longer a part of that program.
That is correct.
Then, okay.
That is correct. There's a 5-year lifetime limit to benefits within that program for those that are qualifying there as well. And then we work with them for 2 years. And then at the end of that 2-year period, if we've done all they can, they have to go off and they're not eligible for another 2 or 3 years to even come back on.
Okay. And I've never been the liaison to your board, so of the group, I may be the one that knows the least. That's why I was, when I was looking over this, was trying to see what things jumped out at me.
Sure.
And, you know, we all, as we know, we all serve as liaisons to different boards. I know you are a current liaison. I think Commissioner White, you've previously been a liaison. Commissioner Caruth, I don't know if you have over the years. Okay. Commissioners, do you have other questions?
I do, and it's totally kind of a different direction.
Okay.
And I'm thinking, because having been on the PBH board for the last 12 years and went through the transition that PBH went through and seeing the success that they have been, so much that the state copied it, you know, I'm sure there's whole careers that are based on nothing more than figuring out how the funding streams work and how money's supposed to be directed and gone. And I know at the local level, I saw in, I guess, your report where the caseworkers even have to document the time by the hour, or even down to or some segment of an hour, to determine which program it gets charged to. And then somebody's got to sit in your accounting department and straighten all that out and reconcile all that. And then a state auditor shows up, and they come in and review the stuff. So you've got, above the county level, above that caseworker, you've got a whole stream of people above them and making sure doing nothing but that money is spent in that right program in all these silos.
That's exactly right.
What is it going to take to, within those broad categories, the 4 categories that you're service in, of moving this to more of a block grant where he says, here's all the money, you guys come up with your own local plan of how you're going to deal with your social service issues in your own counties?
You just answered your own question right there. That is the solution.
Yeah, I mean, just you
grant
basically blow it up
yeah.
and say, okay, these are the things you have to provide for, and here's a pool of money, and you move it around and develop your own business plan, and, you know, because I think that would, the people we complain about, and I think that's where there's a lot of people employed in this country that aren't directly helping people. They're
in the fiscal 101, the capped allocations.
Yeah.
That's a perfect example where if the feds and the state would just pull that money, you would not believe, and Connie can definitely talk to this, and others that do day sheets, that's the day sheet that you're talking to, you would not believe the time that is spent just doing that day sheet, because they account for every minute. We have advocated in the past to do what's called random moment sampling with day sheets, where basically they capture a portion of what they do. But right now, the state requires us to basically capture every minute. It's ridiculous. It really is. It's ridiculous. And that would be the solution, to take, like in child welfare, take all the child welfare dollars that we have, put it in one, and just let us pull it down. It doesn't matter if they're this or that, just let us claim it. And it would make our job so much easier, because that way they would have more time to spend working with the families and helping the families out, instead of doing the administrative nightmare. The paperwork, I wish we could visualize the reports and the paperwork that are required within certain areas, like in child welfare and adult welfare. I know one time, I do remember this, and this is, again, everything's online now, but I can't remember who did it, but they took a policy manual for economic services and took each page and laid it out, and it went around the whole General Assembly building. That was like in the early 90s, and it hasn't gotten better.
20 years down the road.
Yeah, it's gotten worse. But yeah, that's you answered that question. I think combining the grants would be the perfect example.
Is there any movement among DSS directors to try to push something
yes.
like that?
Oh yes.
Okay, because I was going to say is that that's something I think would be a great goal that would be for the NCACC to pursue for the counties, is to simplify the funding streams for
Well, and a lot of it would have to be at the federal level too.
Well,
That's part of the problem. But
there
has been discussions in Washington about simplifying the funding. States have been pushing that more and more now with all the various grants that we have. And again, too, you talked about the monitoring. We get monitoring for 4E, which is that specific pot of money that we use to support foster children that meet classifications, and we pull it down for in-home services as well. There's a monitor that comes annually and pulls cases, and if we've made one mistake, we could have an $80,000 payback. If we've determined a child was 4E eligible that wasn't, and we've claimed those dollars, we could have to pay back every cent, and that it adds stress and burden to the workers that really is so unnecessary. But bureaucratic nightmare, yes, DSS still has it.
Okay.
Can you rectify, if you turn to page 90?
page 90, right there at the very bottom, number 18, home-based services, says that the county's spending $957,007 for home-based services.
Mm-hmm.
If you go to page 94, it says the same thing. If you then switch over to page 101, it's actually a, okay, it'll show a negative number of 957,07. We got three entries of $957,000 that the county's having to pay. Excuse me, 2 entries that the county's having to pay, and then 1 entry that it's being minused out. Do you have any understanding of that, or does anybody have any?
Yeah, I might call on Erica to help me with that one. I'm not sure what that's reflecting there.
Could you call
Page 90 references a payment that we are paying $957,007. Number 18.
Home-based services.
I'm assuming that's the administrative cost of the program total.
Okay.
And it says it's not a mandated function from statutes.
Mm-hmm.
And then on page page 94, it has the same entry, exact same entry at number 18. And then page 101 shows that it's a negative, that the county's not paying it.
It looks like it, looks like it picked up multiple lines of the same service on multiple lines. So I'll have to look at that spreadsheet again. Could you scroll to the bottom, Kay? Because it should have a total.
Oh. If you don't mind looking into that, I was curious about that.
Yeah, I'll do that for you, and my apologies. Because I noticed they all say 18, so meaning it's the same line.
So I'm just trying to figure out, is it that we're having to pay $957,000, or do we pay it and then get it back somehow?
We do, well, in-home services that's the service where we basically, if we substantiate a case of abuse and neglect but don't remove the child, it can be transferred to in-home services. It is it's a mandated service, so that's not quite accurate that it's not mandated. We are required by general statutes to provide it, and we do receive reimbursement for services. Again, we can claim $4E at times, that block grant. We can claim that if the child is 4E eligible. We do get some other revenue sources, not much, but we do get some. So it does pull down revenue as well, too. Now, it's not pulling down 100% revenue, though. I can assure you of that. I wish it was, but it's not.
Right. Now, question I have is it still the requirement that the agents, workers, whoever deals with clients has to register voting registration each time they come in?
Yes, yes, in fact,
and each time, even if the client has registered to vote, they still have to go through that.
We ask, yeah.
You have to continue to do that.
We have to continue to ask, yes, though that was part of the Motor Voter Registration Act, and we are monitored on that as well, too.
And if you don't do that, then there's penalty for that.
Yes, there was a group actually going around pretending to be clients to test DSSs if they were registering, or asking people if they had registered to vote. It's a very important process, and we actually have a lot of protocol in place at our front desk to make sure that we're meeting that standard. And we issue fishing license as well, too, to our clients. And we process unclaimed bodies as well, too, just in case you didn't know that. So there's a couple of those duties we do that don't always float to the top. And all those are required.
Thank you.
I've got a couple questions. You mentioned that the federal government, the funding's around 60 to 65%, and the state was 10% at one time, and it's went down to 5%. Have you seen any reduction in the federal funding in the past few years?
Well, yes, we've seen reductions in what's called the Social Services Block Grant, which is basically an all-encompassing grant that we get to provide services either through child welfare or adult protective services or adult services. That grant has been reduced in the past. Now, it hasn't been reduced much lately, but that one has gone down over the years. But for the most part, The federal funding is held steady for the most part.
And how about the county funding? Is it?
Has increased tremendously over the years, especially with child welfare.
Right, okay. And we mentioned, or you mentioned the healthcare reform and expanding the Medicaid requirements or eligibility. Now, once that takes place, is there any federal funding that's going to help pay for some of that? Or has there been any discussion of that, or is it just they're going to increase the eligibility? And
yeah, I think basically, and Trish can correct me if I'm missing something, but to my knowledge, again, we could add workers to help address that influx, but there would be cost to the county on that. So,
do you have any idea of how many more cases that would potentially bring in? Or?
Trish, have you had any analysis on that yet?
Well, I've seen some reports, triple.
Yeah, you want to come up to the microphone?
Yeah, you have to come up to the microphone.
Unfortunately, I'm hearing about triple because it's going to expand eligibility to at least 400% of poverty. So it depends on what the state implements.
Wow.
But the state is not getting, they'll get money to build the infrastructure like a computer system to help route clients, whether they're Medicaid or they belong to the pool that they can choose from, the benefit.
Right.
But there's no cost to actually administer the clients at the county level, my understanding.
Okay. And then one thing I thought has been interesting since I've been serving on the board is just some of the facts and statistics that you discuss and throw out there. And I was wondering if maybe you could, touch on two of those, and that'd be how many people receive food stamps in the county, and also how much does Medicaid, how much in the county is spent on Medicaid, the whole program. I know it's not just county dollars,
Right.
but.
I'll call Trish back up here to help me some with that too. Food stamps, I believe the almost 13,000 cases we have translates to how many people? I don't want to.
One of your charts shows that we
Yeah,
have
it does
about
show it.
23,000 clients who receive food stamps, and we're spending, we're issuing about $3.2 million, $3.4 million in food stamp benefits a month, and that continues to increase. And those are a few of your charts in there.
And that there's no county dollars in the actual benefit. That's all federal dollars.
Okay.
But that's part of the
Right.
clients and the monthly, the research or the reviews that we're doing right now that we're overwhelmed with are primarily food stamps. Now, Medicaid spending, I did not bring my claims data, but it is millions of dollars a month, millions and millions of dollars. And I can get that for you if you'd like, but I did not bring the claims data because the county doesn't participate in that cost anymore. So, but I'll be glad to get that for you.
I would like to see that. And then you mentioned the open-ended funding. I was wondering if you could touch on that again. I wasn't sure if I truly grasped what that was.
Open-ended funding, basically, again, it depends on the area that you're talking about, but like in Trish's area and in Angela's area for child support, basically, the federal funding exists no matter how much we spend. And that funding basically is reimbursing our cost to administer the programs. And that includes staff and, of course, staff and benefits. And then any costs that are associated directly with that program. Like for Angela, it might be perhaps, the cost of genetic testing or going to court, the legal costs that we have at going to court. So we basically can claim those expenses no matter what they are, because the funding is always there. It's unlimited from the federal government.
Okay, all right. And then I have one other question. With the reevaluation, we're trying to fill a $17 million shortfall.
Mm-hmm.
And, I've stated that I would like to see a 5% across the board cut. And I was wondering how a 5% cut would affect your department as a whole. Would that be, more staff cut or program cut or a combination of both, or?
It would be a combination of both, depending on, it probably would be a combination of both, because I think the first approach we would look at is to take a look at our non-mandated services. But we do have staff associated with some of our non-mandated services, so it would probably be a matter of we would reduce non-mandated services or eliminate non-mandated services and the staff associated with them. So that, I think that would, it would be probably a combination, I would imagine.
These 23,000 people on food stamps, do you have a record of how many are working and how many's not working?
We can capture some of that data, and there are a tremendous amount that are working because the income limit.
What is the time limit they can stay on food stamps?
There's, as long as they're eligible, as long as they're meeting income and asset guidelines.
As long as the taxpayers got money enough to pay in and pay it, right?
That's right. That's an the food stamp is still, food stamps and Medicaid are still basically entitlement programs. If you qualify, you can receive the benefit.
But when we talk about federal dollars, that's really money out of our pockets.
Is it federal dollars pay the food stamp benefit and federal and state dollars pay the Medicaid benefit? And the Medicaid benefit is, I mean, because you're talking about long-term care, prescription drugs, it is literally millions and millions of dollars just in Cabarrus County.
I know a lot of times people talk about, when they say federal dollars, they say, well, it don't cost us nothing. They don't realize, hey, that's out of our pockets too.
It's not costing the county tax dollars, you're right, but it's federal and state dollars funding as benefits.
Okay, one other thing I'd like for you to touch on, during the course of the last year, we've tried to get your department along with some other departments to work together, because some people that come see you also go to other departments. So just to make sure that people in the community that watch this on TV hear, what are some of the efforts that you have made to kind of consolidate the process and make sure that, you know, people that are coming to see you are also getting other services that they would qualify for, and you're sharing data and some stuff like that?
We have been working through the consolidation process since about last October. And of course, I think we even developed a plan that we did share with you at some point. We are working on combining positions and looking at ways to create efficiencies within the consolidation. That's one of our first goals that we're doing. Of course, we're not physically together yet. That will definitely assist us in that process. But we have some ideas on the table that we're batting around to look at ways to make things more efficient. The Community Resource Connection program, which is helping to serve aged and disabled individuals, is a big step in consolidating those efforts. In fact, that's not only dealing with the public agencies, that's dealing with private agencies as well. So we're looking at that as well too. Our goal is probably in May is to try to do some outreach efforts to our local towns throughout the county to talk about what consolidation will look like, because again, it doesn't necessarily change the dynamic of the service, but it just may change how the service is accessed, especially when we physically relocate under one roof. But we hope to do some outreach efforts starting once we get through the budget process, starting with that, and again, try to find efficiencies within our department. Our goal would be one client, one worker. That's very difficult with the complexity of all the programs and services that we have, but we're working towards that as best we can.
Okay, so consolidation, the goal would be one, better customer service, and the other would be to reduce cost by finding efficiencies within multiple departments in the system.
That's correct. And in fact, you know, we'll find those efficiencies initially just being under one roof. That will help reduce being scattered amongst 3 or 4 places.
Right, and we'll be talking about that soon. So
that's right.
All right. Any other questions, commissioners? I want to say thank you very much for coming. Again, since I'm not your liaison, there are a lot of things that I don't understand, and you know, I think you all know. A lot of times people presume that we know more than we know sometimes, and that's the case with your department, because I mean, I know what you've told us and everything else, but it's very good and helpful for me, at least, for the departments to come in like that and try to explain what's going on and what's mandated and what's not, and really how you're trying to work to provide a good service and also to be good stewards of the dollars that you're responsible for. So thank you very much.
And I would invite any commissioner at any time to give me a call and make an appointment. We'll be glad to go through the building and show you more detail about what we do day in and day out. Thank you very much.
And you have a wonderful staff, I will say that.
Thank
and they've
you.
always been very welcoming.
Thank you very
especially one day a
much.
year.
So
Inside
we
joke.
appreciate all that you do for us. Thank you so much.
Thank you. Commissioners, can we take about a 15-minute break and come back, according to the clock on the wall, come back at 6 o'clock, ready to start? Would that be okay? Great. We'll recess for about 15 minutes. Thank you. Okay, thank you for the break, and we are now going to reconvene. The next section that we have are discussion items that we will take action on at the March 19th meeting. And as a reminder, after we do presentations on these, then we will look at the regular meeting agenda and their suggestions if it should be consent or new business, and we can always move things around on that agenda at the end after we've had all our presentations. So the first thing that we're going to talk about is the Old Bethel School property. County Manager.
Yeah, Madam Chair, the discussions are still going on with an option to dispose of the property. So the parties have asked that we table this again until April, and they'll be ready for discussion and bring it with those options.
Okay. So the next item that we have is concerning the landfill operation, and we have Kevin Grant and Kyle Bilfer here to talk to us about where they are in that process.
Good afternoon. I don't think we have information needed at this time that would warrant a decision on what to do with the future, but we have been making some progress. I was able to meet with the Department of Environment and Natural Resources, the hydrogeologist folks up in Raleigh on Friday, to discuss the issue of expanding to the south of our current cell. And Kay, I don't know if you can put the map up just as a reference. It'd be the area that's highlighted in yellow. And what we're looking at, as we discussed earlier, is to expand with an unlined area instead of the liner and leachate tank, which adds significant cost to it. The meeting was fairly successful. They are open to the idea of expanding without a liner in that area. There's some things that they want to look at because there's some abandoned groundwater monitoring wells that we have not looked at for a while, there was no reason to. In that area, they have asked us to do 2 rounds of sampling, which would mean run one, say, in the month of March and then one month of April, just to kind of get an idea of what's in there, and to see if it's coming from the old closed-out MSW, which is the Unit 2 site, which is to the right of the area in yellow that we plan on expanding. Other than that, though, they're pretty comfortable with that idea. We just have to get an idea of what's going on over there and give them an idea, and to give them a better sense in terms of how much area they would allow us to expand with not a liner. Then there would be an issue that the solid waste department head would have to make a ruling on, and that would be the monitoring buffer, which would be the kind of the buffer between the Unit 2, which is the old MSW cell, and then where our current expansion would be, and then likewise on the left where the property line is. So we did not get an answer there, and we hope to get that shortly. So we are making some progress, nothing that I can give to you at this point to help make a decision on what to do once our current airspace is used up at this point. The other item is that Greenway Waste is still putting together a proposal for us. Do not have the formal proposal at this point, but basically they're looking at taking over the operations of our landfill, meaning the operation taking customers at the scale house and then operating the actual landfill where you're placing the waste and covering the waste. Like I said, don't have all the details yet, but that's kind of the summary of it, and then they give us a percentage of the tipping fee. So they would handle all the operating expenses, but we would still handle any type of engineering for future expansions, and then closure, post-closure would be us, and I believe they would also cover financial assurance while they were operating it on our behalf. But don't have a whole lot of the final details on that one, and hopefully we'll have that within the next week or so. So I'm hoping the month of April we should have some data where we can take a look at, if we go at it alone, what would be the construction cost, and how that would affect us going forward.
Okay, so, we need to table this again till April, and in the event that you don't get the information that you're planning to get in the next month, if it needs to go to May, then I think you can let, Kay or the county manager know, and then we can move it up to non-action item for April and then put it on for action in May, if that's the case. Otherwise, we can just put it on for action and move it to the May meetings. Does anybody have questions about where they are in the process or anything they didn't touch on?
I was looking at the elevations, I'm on page 234. Yeah, there you go. I was looking at the elevations. Do you go down to a level, do you dig out to get a level elevation before you start filling it in? For instance, at the very bottom of the point, you're at grade elevation of 745, and it goes down to 738, and then back up to 742. Do you level it out before you start?
You would. Basically what you need to do is ensure that you are a set height above the groundwater, wherever it's
Right.
at. And then based on your elevation, you would dig it out, or what we would do is look at what is the most efficient way to build that cell. That area further to the south, that would be the last area that we would touch. That may not be an area that we do future landfill activities at this point.
But, well, if you flip it around, if you go from the top down, which is what you have phase 1, phase 2, you would grade that out to a certain elevation, it sounds like
Correct.
elevation above the table water?
Yes, yes.
Okay. And then you'll go as high as, what is the closed area, unit 2, to the right?
You would actually, yeah, or you would, where our current C&D landfill is at, directly to the north of there, which is approximately 800 feet. You would probably just run it out that way.
Okay. Thank you.
Any other questions? Okay, well, thank you for the
Thank you.
update. Okay, next we have a Special Olympics update and request for contract renewal. Emily Riley is here. How are you doing?
Good.
Welcome.
Thank you. Good evening, everyone. Thank you so much for having me here. In 2000, Cabarrus County Schools was asked by the county manager to oversee the Special Olympics program for Cabarrus County. A 5-year contract was developed, and the funding for the coordinator's position was included as part of the county government budget. The current contract expires on June 30th, 2012, and we are requesting a renewal of this contract along with funding for the coordinator's position. As most of you are aware, Special Olympics offers training and competition in Olympic-type sports to individuals with intellectual disabilities and other related developmental disabilities, ages 8 years and up, and there's no maximum age limit. Special Olympics is pretty much the only source of sports and recreation that many of these individuals receive. I know that you all received a letter from me which explains in depth how Special Olympics is organized in Cabarrus County, as well as the accomplishments of our program. But I want to hit on some of the highlights about our program and share with you the faces of the individuals who are impacted by Special Olympics in Cabarrus County. So if you can bring up the next slide, please. In the last 12 years, since 2000, Special Olympics Cabarrus County has steadily increased the number of registered athletes from 500 to 1,200 athletes. Special Olympics Cabarrus County has tripled the number of training and competition opportunities for athletes by going from 5 sports to 15. We've hosted Special Olympics North Carolina basketball and cheerleading tournament in 2005 and 2006. As many of you are aware, it was a huge feat in order to do those tournaments. We host an annual Special Olympics North Carolina 5-on-5 and 3-on-3 basketball series in January, as well as a Special Olympics North Carolina athletics and softball qualifier in April. We have 3 athletes who are on the global messengers for Special Olympics North Carolina, and one of them was chosen to be on the athlete council. We have amazing volunteers, and one of our volunteers, Betty Lewis, who's also a coach, was chosen as State Volunteer of the Year in 2010. And if you can bring up the next slide, this is Amanda Bass. She is one of our local athletes, and she was actually chosen as an athlete to compete in the World Games at Athens, Greece in 2011. And she received 3 medals in track and field events. Next slide. Todd Bass, which is her brother, was chosen as Athlete of the Year in 2011, and that's a huge accomplishment with all the athletes in the state, and that he was chosen to be the one. That is Keith Fishburne, who is the president of Special Olympics in North Carolina, awarding him with his plaque. And then the next one, we added a new sport this year. We are very proud to add alpine skiing, which a lot of people think is kind of bizarre since we're in the middle of the state. But we train locally on dry land, and then they did compete. We had 4 athletes compete in the Winter Games this year, so that was really exciting for us.
This is kind of like the Jamaican bobsled team, huh?
What?
Kind of like the Jamaican bobsled
Exactly,
team?
exactly. Special Olympics Cabarrus County has a strong program, and we continue to build. At this time, we offer a variety of different opportunities for the individuals we serve. First one we offer is our sports program. A lot of people aren't familiar with this. We train locally in 15 of the 19 Special Olympics North Carolina sports. We offer training in equestrian, which is the picture up there. Those are some of the athletes for equestrian. The next picture is one of our athletes who's cycling. And then the next one is one of the 2 soccer teams that we have. And we offer many other sports, and we adapt each sport to the levels of the individuals. We're always looking to add new sports, and we're really excited this year that we're going to be adding roller skating in the fall. And after training locally, many of our athletes attend the state level competitions for their sport, and we just actually had 65 athletes to attend the Western basketball and cheerleading tournament that occurred in Charlotte this past weekend. Our Young Athletes program is the next program that we have, and this is for individuals who are too young to compete in Special Olympics. They're between the ages of 3 and 7, but they need to learn those basic fine motor and gross motor skills. It's a great program because it's not open just to individuals with disabilities, but it's also open to individuals without disabilities. So this is how we serve the younger clients and get them prepared to get ready for Special Olympics. And we've expanded this program from 1 preschool in the county when we first started to 3 preschools, and now we have the program in Long Preschool, Mary Frances Wall Center, and the McKnight Center. The next program that we offer to the individuals who qualify are Spring Games, which I'm sure many of you are familiar with the Spring Games. It's a day event where athletes are able to compete and get rewarded in track and field events. This year, and there's an example of the torch run and some of the athletes competing in the next slide. This year, the Spring Games is going to be on April 18th and 19th at the Cabarrus Arena. So I encourage you to come out, either one or both of the days to cheer on the athletes, because it's an amazing event to watch. And the next slide is just one of the athletes showing off his medals. There are tremendous benefits to having an outstanding Special Olympics program, and I've heard from numerous parents and agency workers about how Special Olympics has changed the lives of their athletes, including but not limited to the increasing self-confidence, the building of friendships, improved physical ability. Special Olympics is one of the top. Special Olympics Cabarrus County is one of the top Special Olympics programs in the state, and that is only possible because of the support that we receive from the county. The contract between Cabarrus County and Cabarrus County Schools allows for someone to coordinate the program, giving their full attention to all aspects of the organization, including program coordination, fundraising, and building of necessary relationships in the community. The contract also opens up relationships for our organization. We are so thankful for the support we receive from different county departments, including but not limited to Cabarrus County Transportation, Cabarrus Arena and Event Center, and Cabarrus County Parks and Recreation, as well as different departments within the school system. Though Cabarrus County generously funds the coordinator's salary, it is through grants, individual and group donations, and fundraisers that Special Olympics is able to persist. I have given you all a budget, which is up on the screen, for our expenses and revenue for 2011 and 2012, so that you can see what it takes to run our program. Without a full-time staff member charged with the organization and implementation of Special Olympics Cabarrus County, our program could not be as successful. On behalf of the Special Olympics Steering Committee, athletes, their parents, and volunteers, I want to thank the Cabarrus County government and Cabarrus County schools for making Special Olympics a priority in this county, and hope that you will see the importance of renewing this contract once again. Any questions?
Thank you. Are there any questions? This would obviously be a part of our budget, and the request is that we would fund the position for another 5-year term. It's approximately $54,000 a year is what we're looking at. So I want to make sure everybody's.
Yeah, just to add to that, Madam Chair, the budget that you see here, Emily as the director, the contract would pay for Emily's salary and benefits. She, as the director, coordinates the entire program, and she also does these fundraising events to fund the rest of the program. So it's not, the whole budget is not what we're contributing here from the county. There is additional funds needed to run the program, and that's part of her responsibilities to go out and find those monies.
Yeah, I didn't even include in that budget the salary that, because you all
Right.
offer that.
So-
I was just trying to show you all what we as a, committee and
Sure.
as the coordinator have to raise. So.
What's the rental expense out at the arena? Because I don't see it on here on the county budget.
I know, I'm sorry, I didn't break it down very specific, but it was last year $675. They give us an amazing deal for 2 days of usage. And they're very supportive as well.
Any other questions, any comments?
Everybody
good with going forward?
I just want to sing the praises of Special Olympics because I think it's a tremendous program. We've got, I think it's probably one of the more successful things we've seen in this country over the last, 30 years that it's been in place. And I want to play the bad guy for a second, is that what we're doing is renewing a contract, and we're still staring at the fact that with 63-cent tax rate, we're at a $17.5 million budget deficit. So I just want to point that out. And I know it's great, a tremendous program, but where do we start looking? So, but if we're going to approve this before the budget is even considered, and I don't want to be the one that be labeled as the guy that's against Special Olympics, because I'm not. But we got to look at, we got to start thinking about, we keep talking about wanting to make cuts to keep from having to raise the tax rate above 63 cents. This is a discretionary program, totally and completely. We have the freedom to cut this if we want to cut it. We don't have, it's not mandated. So I'll just bring that up.
And we do
As an
have that
observation.
written notification is required by May the 1st to renew the contract. I think the Special Olympics, does a great job, and I know that the impact is felt throughout the community. It's great to go out there and spend time on that day and just see the expressions and everything that's going on, because it is such a great program. And that's just one day that we have it at the arena, but then you've got the state competitions and national competitions, and international competitions, and it is amazing to see the excitement on the participants when they're out there.
And having and I think just the training itself, because so many kids, like, they're in the Special Olympics. I know growing up with a couple of kids like this that were special needs, these kids that get picked on a lot of times by their classmates when they're younger, and they don't get included in sports when everybody else is playing baseball or everybody else is playing tag. They don't get included. And what it's done, I think, is just, that it's exciting to see, because I've seen there's some pretty good athletes out there.
We have some amazing athletes. They play a lot better than I do. Well, and I just want to point out that it's unfortunate that Special Olympics is one of the only recreational opportunities for a lot of these individuals, because they, like you said, they cannot participate in the regular youth leagues. So they do seek out Special Olympics for that recreational purposes.
Yeah, I think it's a good program, and I appreciate all you do, and I think it's a good part of Cabarrus County, so.
Any other comments? Commissioner Burridge, you have anything you want to add? You don't have to. I just want to make sure I don't overlook
No,
it.
I think it's a good program, and I'd hate to see us cut it out. Especially, we throw a lot of money away on other things that this benefits these children to a point that it's something they'll never get to do but one time. and, you know, I don't think we'll take it away from them.
Commissioner White, I know you already spoke. You
I'm
good?
fine.
Yeah.
Okay. Hey, well, based on the conversation, go ahead.
Yeah, I was just gonna say, we can go ahead and put the numbers in the contract and have it, I've got it set. If you so choose, we can put it on the consent agreement for your meeting. We'll go ahead and put the contract together.
So
get the numbers in.
we're all voting to fund this.
Yeah.
Outside of our, it's not a mandatory program, so we're all agreeing to fund it. Is that what we're doing?
That's
Yeah,
what I
sounds
want to
like
make
me.
sure. I know that, I mean, we work on the agenda in a minute, but I know, you know, you might not want to stay for the whole meeting, so I kind of wanted to make sure that she knew before she left which way we were leaning. If we're, I mean, so far, everybody said you appreciate the program and we're in support of the program, so I take that to mean that we intend to renew the 5-year contract, and therefore we would fund it in the budget,
Yeah,
unless
and
I hear otherwise.
don't get me wrong, my observation had nothing to do with the fact that I wholeheartedly support this program. So,
I understand, and we have, as you know, and everybody knows, the budget is like issue number 1, and so everything that we do over the next couple months are directly impacting it. So if I don't hear anybody saying that there's a problem with it, then we will.
Why do we have to do it by May the 1st? Because this contract expires May 1st, or actually June 1st.
Yeah. Let's see it.
Or it expires June the 30th. Why do we have to renew it by May 1?
You don't, I
Okay.
think you have to give notification if you're not going to. I
Well,
believe
no, it
that's what-
automatically expires June 30th,
That's
2012. So we do not have to give any notification May 1. We don't have to do any vote today.
You don't have to vote today. I think what
Yeah.
really what Ms. Riley came to do was to give you guys an update. We've not
Yeah.
had an update from Special Olympics in a while. The contract is pending to expire in 2 or 3 months, and she was trying to get some direction on
Okay.
how she needs to proceed with the program.
okay.
Thank you.
Thank you.
Thank you.
I do believe I pulled that language straight out of the contract document.
Okay, the next up, we have the self-insured health insurance fund from Pam Dubois.
As we spoke during your retreat, we talked about the increasing cost to our health insurance plan, and that we had an exceptional year as far as claims were concerned, and an additional $1.4 million. We've done an evaluation, and if you were to go to page 265, you would see the, basically every year that we've been self-funded since 2005, and we've done an evaluation of how we project this fiscal year to end up, and we should be about $2.1 million in the hole as far as our health insurance plan is looking at this point in time. When we did our fund balance assignments at June 30th of 2011, we placed $2 million set aside for health insurance, not knowing whether we would need it or not, and unfortunately the need actually has come into play. We have also, when we had the retreat, talked about all the changes that we're making to the health insurance plan to avoid cost like this in the future, to help manage our claims better. So at this point, we're requesting about $2.1 million is what we need. We're asking for $2 million from the general fund to make a contribution. We have some other adjustments that we'll be making to revenues and some changes in the expenditure line items. We are still working on further things as far as the health insurance plan is concerned to alleviate future costs, but this would help us get us back in balance so that we would also meet our expenses and have our reserve in place. So before you is to request a $2 million contribution from the general fund to the health insurance fund to help alleviate the excessive claims that we had this year.
Okay, any questions?
How's the administrative fees figured?
The administrative fees are figured on a per participant within the plan. That would be any employee or anybody else that the employee had paid for their children or spouses. It's at a flat fee that's established by Cigna, and it's charged per month to administer the claims process.
When's the last time we sent that out to bid?
Mark III does an evaluation for us every year, and he does go through and checks with the other like Blue Cross Blue Shield, and at this point that, from my understanding, and I could get some more information from Lundy and Joanna, that this is the best rates that we had available to us. Based on what we're projecting to see in 2013, there's very little change as far as that administrative fee is concerned. And they are a third-party administrator, and they process all our claims. So from Mark's recommendation, this was the group that they suggest we continue with into the next year.
Because the number of employees that we have has fallen, but yet our administrative fee keeps on going up.
We have dependents and children and retirees that are also on the plan.
Okay.
Because of the retiree health insurance program that we have at least 100 retirees on the plan. And then all the spouses and family members that are on the plan.
The $8.1 million which is pretty much almost it's like close to 4 or 3.5 to 1, 3.5, 350% increase since 2005. What is making up the bulk of claims? Is it retirees, family members, or employees?
It's current employees from the information that we've gone back and reviewed. We did actually have a conversation about this. There have been some significant medical cases this past year, and those individuals have also hit the stop loss.
Okay.
So the stop loss has picked up the differential that goes into that, but we've had significant cases there, and we haven't had a lot of plan change designs in the last 5 years where a lot of other governments have. And that was a big part of what we presented to you at the board retreat, was making significant plan changes to make the health insurance more consumer-driven by the employee so that they can understand the full cost of it, but yet have avenues to use the health center, generic drugs, and other avenues to maintain cost.
How has the rent doubled since 2007? It says building rent.
We used to be in a small facility
Okay.
where the health clinic is. It was inside, and you had to go into the glass doors near the elevator. And I don't remember what year we moved.
It just seems like it steadily increased except for 2009 and 2010, but from 2010 it still went up.
There was, the
6,000.
contract called for a CPI increase every year.
Okay.
And then 2 years ago, I believe we moved from the original location
2010, because that's where the building
Yeah.
renovation money is.
to a new office within the same complex, but it was almost twice as much square footage in there,
Okay.
and that's when the rent went up.
And like medical supplies, last year there was no money spent, and this year 45,000.
Let me see. I did get the answer to that question. Give me just a second to help my blind eyes see a little bit better. Medical labs and medical supplies are predominantly the same thing.
Okay.
So it went from 38 to 45.
Okay. Just on different lines.
Yeah, we're trying to consolidate a few of those line items.
Okay.
Well, I don't know if someone's giving you the correct information, because if you look in 2010, supplies was $10,000 and labs was $31,000. And in 2009, supplies was 0 and labs were $28,000. So I don't know if,
It's not very consistent.
no.
And, I mean, like office supplies, 2010, it's $1,200, and then this year it's only $300.
Right, 2010 is when they moved into the new facility.
Okay.
But we've had a larger space. And I'm trying to remember if the hepatitis shots that we have to give, are they every other year for our employees? But yeah, medical supplies and medical labs are basically billed the same way. At one point in time, they were split apart. One times they're combined. But I do know that the hepatitis shot has a significant cost to us, but I don't think it's an every other year. I think it is an every other year cost that has to be done. And then in 2010, let me think. 2010 is when we hired the 77 detention officers, so we had a significant cost in new hirees. And they had to go through all the drug testing and the physical fitness test.
But they're
I'm
not,
pulling this off the top of my head of memory. But if you need an analysis, I can probably go back and get you some more information on the medical labs and the medical supplies, because 2007 is when the clinic actually started, and that's why there wasn't anything prior to that. But I can probably get you some historical information on, what caused it to fluctuate each one of those years, if that would be helpful.
Well, and the rent, if they moved into the new space in 2010, it was 23,000. It went up to 30,000. I know you said there's a built-in increase, but that's a big increase over 2 years.
Going from, what did you say, from 16 to 23?
Well, no, from the 23 is 2010, whenever they moved into the new space, and it was 23,000, and then it's 30,000 for 2012.
They moved during the middle of the budget year.
Okay.
It was not a full year in 2010 of the new space,
Okay. So
where you
then-
see that 2011 and 12 are more in line,
Okay.
because we had to put renovations in. At one point in time, we had the old space and paid, did we actually pay rent, or did they just let us renovate the space until we moved in?
Okay.
But it was during the fiscal year. It wasn't a perfect cutoff
Okay.
on July 1st.
That explains.
But would you like for me to get some more information on the medical supplies and labs?
I would.
Okay, I would be glad to do that.
Any other questions concerning the health insurance fund? Okay. The next item we have is a water line easement on the arena property. Jonathan Marshall.
The city of Concord has contacted us about obtaining an easement on the frontage of the arena property at Highway 49. This is part of the Concord-Kannapolis water line connection to Albemarle. Of course, one of the points of terminus is at an existing water line in 49 in the arena, so they would be connecting there. Our largest concern was that the time frame for construction could correspond with some of our major events there, so they have agreed to add to the plan specifications a note that they'd have to check with the owner and operator of the arena and fairgrounds to coordinate when that work would be conducted. Now, they do intend to bore under our driveway, so there will be less disruption because of that, but we're still, considering that we do a lot of our parking for the fair down that direction, we do not want this to happen during Fair Week or any other major event where we're looking at parking in that area.
Did they give you an idea of when is that in September that they're looking at doing it? Do you know?
They have not given us a construction schedule. They're still doing the engineering. They're still in property acquisition. We've heard from some other property owners along this line. As you can imagine, it's very extensive from the Stanley County line through the town of Mount Pleasant. Actually follows 49 for the most part, but in Mount Pleasant, it takes a jog off of 49 through across some additional roads. And then in addition to the connection at 49 itself in front of the arena, they will be going up Cold Springs Road and making a second connection, it appears, at NC 73. So there are a number of property owners affected by this.
Any other questions on the water line?
If we agree to do that, then you can be certain to make sure it doesn't happen during big events or during the fair.
And that was the
Be clear.
intent of the note they agreed to, is that would go on the plan specifications with the contractor, and then we would coordinate with both them and the contractor on that.
It's a pretty long line. I would think that they'd be able to coordinate around some of our events for that small section of it. Next up, we have the Sheriff's Department Administration 7th floor upfit construction cost and construction manager at risk, and Kyle Billiford.
Good evening. The final design for the Sheriff's Department's 6th and 7th floor upfits has been completed, submitted to Cabarrus County's construction standards, and bid out by Turner Construction Company. Turner Construction Company has provided a guaranteed maximum price of $1,484,360. This would be an amendment number 5, to the existing construction manager at risk contract for the detention center. We're looking for a requested action to approve the amendment to the existing CM at risk contract between Cabarrus County and Turner Construction and authorize the county manager to execute the contract on behalf of Cabarrus County, subject to review or revisions by the county attorney. We have Scott Milligan, who's the project executive on this project, can answer any questions about the cost, and I can answer any questions about any of the design or actual impacts to the building.
Questions?
What's the benefit of construction manager at risk?
We take all the risk for the entire project. We bid the project out. Over 85% of the project is bid out. We try to make sure that we put a concerted effort towards getting local and minority participation. We're not mandatory to holding the low bid, and we try to anticipate issues with the building process to where we take all that risk in account when we put a number to the project.
I think also having to see them at risk from the very beginning of the project, they are part of the design of the project, so they can use their real life or practical experience in helping to facilitate the design process.
In other projects that we've been a part of, they've been languishing for 2 and 3 and 4 years. Under a construction manager at risk, how long does a project typically take to build and to complete?
Each project is different for each schedule, so
Okay.
languishing.
Let's use things that we've already done. How about the annex? How many days over the contract completion date did you go?
It was under the contract completion date.
So
3 to 4 months, I believe.
okay. And how about the jail? That was a construction manager at risk, wasn't it?
The jail was completed on the completion date. That was 9/21 was when we achieved the substantial completion for that.
So it seems as though construction manager at risk, you can build it on time or before time.
Usually you're in the process earlier, so you can start organizing and getting products and materials lined up earlier to get exactly what you want, so you don't have a problem later when you're turning it down.
And on the annex, we came in under budget.
Yes, sir.
On the jail, we came in under budget.
Yes, sir.
Okay. And that would include easements, that would include cleaning up cleaning up the land, getting it ready to go. I mean, you name it, y'all take responsibility for it and have a turnkey operation for us.
There are, yes, as far as the drawings go, we guarantee what's on the drawings, we guarantee what we're gonna provide, and unless you make a change, there's not an added cost for that.
Okay.
And all 3 projects across the street came in under budget. In fact, the returned money, any money that is unused, whether it's an allowance or a contingency, reverts back to the county.
And how about if it goes over the guaranteed maximum price of $1.4 million? What if it goes to $2 million? Who takes up the slack?
We're at risk for that. If it goes to $2 million, then without any changes or whatever, that's what the risk, that's what we're guaranteeing, that it doesn't go there, or that you don't have any risk associated with that.
As it relates to the annex and as it relates to the jail, we had those, y'all's proposal, guaranteed maximum price, audited by an independent auditor to make certain that that price is as close to a fair price both to the county as well as to the project itself. Is that correct?
Yes.
Okay. So there's an opportunity for an independent evaluator to look at the prices that you are giving us to make certain that those are fair prices and that is a fair market price.
Yeah, on those projects, Faithful and Gould did that.
Okay. Thank you very much. That's all the questions I had.
Other questions or comments?
Are you, I know that, are y'all doing any kind of contractor or owner-controlled insurance program for this small, I mean, it's a fairly small project, you're not gonna do that, it's gonna have the?
No, we're not
Okay,
gonna do that
okay,
on this
okay.
one. We've done that in the past.
Mhm. Okay.
Okay, this is for, sorry, back to the right page. Okay, so the guaranteed price is a little over 1.5 million. Are there some other costs that we will have to consider with this particular project in addition to Kyle?
Yes, furniture and technology, and obviously the architectural costs.
And do you have some estimates on that? So how much is do you estimate with those other items that the total project will cost?
Yeah, well, the architectural already came in front of you guys and was signed $115,000 for engineering and architectural. We're estimating furniture at $200,000, just to be conservative. In some of the Rowan, Cabarrus County spaces, you've got over 60 desks, not even to count how many chairs and things like that. And the ITS, we were very, very lenient with what we put in there in terms of finances, just to cover ourselves for both wiring and smart boards. We put in $85,000.
Ms. Dubois, how much is the budget that we previously set aside for this project?
$2.5 million.
So, Mr. Billifer, when you added those numbers up, we're somewhere around 2 million?
Yes.
Okay, so it's under what we had set aside to do that project.
Yes, and even the values that I estimated for all those other, except for the architectural contract, I think will be under also.
Okay. And Ms. Dubois, where are the funds coming from for the project?
The funds are coming out of the the jail construction for the housing unit. Mr. Downs has the list of the savings that we've had for all these projects. And after we completely paid for all three of the first facilities, the monies that were excess and left over within those funds are paying for this project to do the 7th floor. And he's got a dollar figure for you of the savings.
The total savings, based on calculations that were done by Ms. Farrington today, for the three projects, Turner Construction returned back to the county $3,711,390. So those savings more than pay for this project.
And so that leaves $1.7 million. And what will those funds be used for?
Part of it balanced this year's budget, and the $5.7 million that we had from capital project funds to help pay for some debt service. And any monies that will be left over when we actually close the fund will go towards the debt service for the housing facility.
Okay, so construction manager risk, what Commissioner White was trying to point out, so far we've gotten projects done on time and at a lower cost, and funds have been returned back to the county. It's those same funds that we're going to use, and we'd set aside $2.5 million. That this is also appears to come in well under that budget. And I don't know if you want to address this or who does. Can you again explain why we are upfitting the 7th floor and what was the agreement that we previously made for the use of that facility?
The project is going to include moving some of the Rowan Cabarrus Community College law enforcement, public safety classes. We will be providing both classroom space, lab space. There's some associated break room spaces, office space, simulator space. And then in addition to that, there'll be a large flexible space similar to this room, but maybe twice or three times the size, that will allow for large gatherings and also allow for the sheriff to have his entire staff in the same location for a meeting, which he is not able to do right now. In addition, the physical fitness area, the existing physical fitness area for the sheriff's department is becoming very crowded, so we will be moving a wall around on the 6th floor to accommodate that, enlarging that area, and that educational space or training space that will be lost as a result of that enlargement will be made up for it on the 7th floor. And in the final part of the project, we'll also be doing a retaining wall between the Washington Square apartments at the rear of the property so that we can secure that bank back there to eliminate any future erosion problems that may happen.
Okay, thank you. Any other? Yes, sir.
Are you confident that the plans are correct? There won't be a $200,000 or $300,000 worth of change orders?
Yes, I'm confident that there will not be that amount of
I
change
assume the
orders.
architect looked at the space, he didn't just look at the plans.
Yes, we've had numerous meetings and walked through
And the
everything.
engineers.
Yes, sir.
Yep, and Mr. Burge and the contractor as well was part of that process as well.
So it's going to be a 4-month or less project?
Yes, sir.
That's why we're bringing it to you now. It's going to be a tight schedule, and Rowan Cabarrus starts classes in August, so they have committed to that date.
We look to give them the notice to proceed 7 a.m. the morning after you all vote the next meeting.
Well, they're getting a permit the day we meet.
You meet on the 19th? We'll have the permit.
Be a little
Yeah, we'll have the permit 3 days after that, but it's pretty tight. We've got to get furniture into that space before that Rowan comes in. And one other space that wasn't mentioned was the EMS skills training lab will be moved into that space, and obviously that's going to be needed as we vacate the lease space where transportation is right now when we make the move to human services.
Okay, thank you very much. The next item that we have, as I believe everyone is probably aware, unfortunately, we did have a tornado to touchdown in Cabarrus County over the weekend, severely damaged some homes, and county manager, do you want to give an update first, or part of this, kind of combine some items
I can.
on this? Okay.
Yeah, as you know, the response was quick and done right as planned. Our county emergency management department, emergency medical services, our transportation department, DSS, the American Red Cross, Harrisburg Fire and Life Safety, and Harrisburg Public Works all responded in a tremendous with tremendous speed and addressed the situation, which was if you've had a chance to go out and view the area, there was that was a very traumatic event for everyone that was involved. So the efforts of our employees to be out there on time and helping them and assisting them in that time of need was tremendous. As a result of the storm, there was a great deal of debris and damage to several residences in the southern part of Harrisburg, or in the southern part of the county. As a result, there's a large amount of debris that's out there, so there's going to be some repairs, and in some cases, maybe even some replacement of some of the homes that were affected by the storm. In the past, with Hugo and I believe the hurricane, I don't remember the name, but however, the boards at that time, and we've already been getting the request from some of the affected individuals, was at the time, due to the damage, the board relieved or allowed permits for no charge for a 90-day period for those structures that were affected by this storm. So we're asking the board at this time if that's something that you feel favorable towards doing again. Not only the zoning and associated building and sub-trade permits, but also the willingness to allow them to accept the debris at the landfill for no cost as well. Related to the storm, it would be a start date and a finish date where we would relax those fees.
Is that going to be passed on to the homeowner? Is that waiving of the fee going to be passed on to the homeowner?
You mean based on the...
if you go to a contractor and you say, rebuild my house, are they going to bill you for something they're getting for free and just accept that as profit?
Well, we would make sure that those affected understand that the board has made this decision, so that they are aware that they can follow up with when they're getting their bills, and they would make sure it's not there.
I was wondering about, we of course, doing this the second time we've done this, and hope it doesn't occur too many times, but is it something we may even look at altering our overall emergency management plan, that when the state of emergency is declared in a situation like this, it automatically includes the 90-day waiver?
We can go that route, or...
that way we wouldn't have to come before us every time we have something like this happen. It was all
I'd like for it to come before us, and so we know exactly what the damage is.
Yeah.
It's not enough. It wouldn't be enough for us just to. It's not going to take up a lot of time, and it's something that we certainly need to to understand better.
Yeah, I think because, you know, the amount of damage or the type of damage in future storms, it may not merit
Yeah.
that 90-day extension.
Because we had, the only other emergency that we had was the ice storm about 3 years ago. We had the ice storm, and thankfully that didn't damage homes, but it was, so that, I just think it'd be good if we just keep on having that come before us.
Good point. Never mind.
Yeah, I agree. Doug Steele from the Cabarrus County Emergency Management took me a tour today of the damage, and it was a sight to see. It's something I've never seen before in my life. The trees twisted, and to see those families' homes, you know, devastated. I mean, it was a sad sight to see. So I know my prayers and thoughts go out to the families, and I know everyone else does, but I'm certainly in favor of doing this.
I'd make a motion to suspend the rules and allow us to vote on this procedure by waiving the building permit fee and CD land fees for affected homeowners as defined on the list that's provided to us for a 90-day period beginning March 6, 2012.
Let's do it. It's two motions.
Independent motions.
First motion is to suspend the rules of procedure. I have a motion.
Second.
I have a second. All those in favor say aye.
Aye.
Any opposed? Okay, now I have a motion to waive building permit fees and C&D landfill fees for effective homeowners as defined in the following list for a 90-day period beginning March the 6th, 2012. Do I have a second?
That's my, yep.
A motion and a second. All those in favor say aye.
Aye.
Any opposed? Okay. So those will pass.
Are you gonna be sure the money goes back to the homeowner?
That's exactly. We'll make sure that the homeowners understand that the fees are waived, so that they can make sure that as they contract with a contractor that they're not charged for those.
Okay, at this time, if you will, you have a handout at your seats about the regular meeting agenda for 2 weeks. If you will look at the list for the consent agenda items, number 3 and number 7, we will table and remove those from this list. Are there any other items on the consent agenda that you would like to pull off of the consent agenda? Or I would accept a motion that the consent agenda as presented minus number 3 and number 7 be added to the agenda.
Do we need to make people aware that April 2012 is National Donate Life Month and that March 21st is Kick Butts Day? And if that would be the case, I wonder if we should put those underneath recognitions and presentations above. And just,
and I would agree with that.
Yeah.
Number 1 and number 2 be moved to recognitions and presentations. There is a chance on number 2, we may have a few students that want to address the board, but I don't know that for a fact yet.
I'd pull 5 off, put that on new business.
Put 5 under new business?
Mm-hmm.
Okay.
Special Olympics update and request for contract renewal.
Okay. That would leave 4, 6, 8, 9, and 10 to stay under consent.
Mm-hmm.
Okay. So then under new business, we have a placeholder request from the Cabarrus County Schools. And then the item number 2 would be the Special Olympics. Okay, and then, of course, we have the normal appointments to the boards and reports, general comments, et cetera, and a closed session in 2 weeks. If that is acceptable to everybody, I would accept a motion to approve the regular meeting agenda as discussed.
So moved.
Second.
Motion and second. All those in favor say aye.
Aye.
Any opposed? Okay, I also, at this time, we do have a closed session. Like, before we do that, I had an email today, and I want to draw attention because it will be before our next meeting. This is a notice of a citizens' informational workshop concerning the proposed widening of Dorada Road in Concord from Poplar Tent Road to Concord Mills Boulevard. The Citizens Informational Workshop will take place on Thursday, March the 15th, from 4 p.m. to 7 p.m. Will be held at Concord Fire Station Number 9 Meeting Room, which is at 1020 Ivy Klein Road in Concord. It's the one right there at the airport, on the other side of the airport from where this particular widening project is. Interested individuals may attend this workshop at their convenience during the above stated hours. Please note there will be no formal presentation. We can make sure that this gets posted, I'm sure. But I did want to remind people, if you are, especially in that particular area, let's see. The proposed project will widen 2.6 miles of DeRidder Road. The City of Concord proposes a best fit alignment to widen this route. In other words, the roadway may be widened to a particular site in some locations and equally in others in an effort to minimize impacts to the natural and human environments. The proposed cross-section for the roadway is a 4-lane divided facility with a 23-foot wide medium, 30-foot wide where double left turn lanes are needed. The posted speed limit would be 45 miles per hour. The road would be constructed to NCDOT standards. The revision of landscaping, bicycle lanes, sidewalks, street lighting, and potential bus stops will be considered during development of the project. Additional right-of-way acquisition and the relocation of homes and businesses may be required for construction. For more information on the project, you may contact Concord Engineering Director Sue Hyde by phone 704-920-5401 or by email at hydes@concordnc.gov. NCDOT will provide auxiliary aids and services under the Americans with Disability Act for disabled persons who want to participate in this workshop. Anyone requiring special services should contact Ms. Hyde as early as possible so that arrangements can be made. So I want to make sure that our citizens know about that meeting, and those that are interested can attend. Are there any other items that commissioners would like to bring before the board tonight?
I did get an email today, I believe maybe from Dennis Testerman, the Soil Water Conservation District, March 31st. It's from 9 to 11. It's a Saturday morning. There's a demonstration and educational session on farm ponds out in the Cox Mill area, the farm out in the Cox Mill area. And since I saw on the report from Michael Schuman earlier today, the aquaculture is one of the things to be looked at, and it's will be very beneficial. I guess it's open to the public, but it's going to be talk about how you manage a pond, farm pond. Ought to be pretty interesting. So.
So moved.
Favor? Oh, sorry. All in favor? Say aye. Aye. Okay. At this time, we will go into closed session. Thank you.